Welcome to our project for a drug-eluting subcutaneous implant to manage rheumatoid arthritis in the knee. I'm Melissa Daigle.
I'm Emily Mora.
I'm Erin Dixon.
And I'm Alexa Pomerleau.
Rheumatoid arthritis is the most common chronic inflammatory joint disease worldwide. It occurs when the body's immune system attacks the synovial membranes that line the joints. It can cause thickening of the synovial membrane that causes stiffness, swelling, and pain for the patient. In severe cases, it can also decrease mobility severely and deform the joint. It can also lead to the formation of rheumatoid nodules, which are bumps that form under the skin, in the chest, and on the brain and spinal cord. These can interfere with blood circulation and nerve function. In 2012, rheumatoid arthritis affected 1% of the world's population, including 294,000 children and 1.5 million adult Americans. Onset affects all demographics, and the average cost for a patient to manage their rheumatoid arthritis symptoms ranges from $15,000 to $19,000.
As Melissa mentioned, rheumatoid arthritis can severely affect mobility, which is why we decided to focus on the knee. We developed an implantable device that elutes drugs. It's similar to implantable birth control, which is a rod that's implanted in the arm and elutes hormones. Our device is a 4 centimeter long silicone rod that has a 2 millimeter diameter, and it elutes methotrexate, which decreases inflammation and swelling, and it also elutes atorvastatin, which decreases pain from the thickening of the synovial membrane. The dosage of the methotrexate is 7.5 to 25 milligrams per week, and the dosage of atorvastatin is 90 milligrams. These drugs elute out of the rod through the pores in the silicone, and the pores also allow for minimal tissue ingrowth, but enough ingrowth that the rod won't dislodge from where it was implanted. The device is implanted underneath the skin between the hamstring and the quadricep muscles, and this is in order to minimize any forces that would be inflicted upon the device from any movement. The device is implanted in a minimally invasive manner and is small, so there's no discomfort to the patient. After 5 years, the device is removed and it can be replaced for continued treatment. And the silicone that the device is made out of is non-degradable and inert, so that there will be no interference with the drugs or the body.
Thank you, Erin. So why should you care? Our device is minimally invasive and requires only one small procedure to implant the device at the knee. Our device remains in the body for 5 years, and during that time, it maintains a sustained zero-order drug release system of anti-inflammatory and pain-relieving drugs. Because our device works to mediate the effects of rheumatoid arthritis, there is no further need for a total joint replacement in arthritic patients. Our device also ensures user compliance and results in fewer, less expensive payments because there is no further need to orally take prescription medication. With all of this, the total cost of our device is around $5,000, with that price dependent upon the dosage required for each patient. It would cost around $1,000 to produce and implant the device, less than $4,000 to load the drugs into the device, and after 5 years, it would cost about $500 to remove the device. With this, a procedure is necessary every 5 years to remove and or replace the device. And along with any surgical procedure or implanted device, there is a risk of infection and malfunction. With all these things, we believe that our device can overcome the effects of rheumatoid arthritis at the knee in ways that no device has successfully done before.
As Alexa mentioned, the gold standard of treatment today includes daily oral medications and total knee replacement surgery. There are clear limitations with both of these solutions. Our competition is outlined here in this table. As you can see, Humira or other disease-modifying antirheumatic drugs are more expensive and have to be delivered frequently. In addition, they're often delivered with other pain medications such as ibuprofen. These can have detrimental effects on the lining of the stomach. Additionally, total knee replacements are also very expensive and have long recovery times. Our device would be cheaper, have shorter recovery times, and be delivered much less frequently than daily oral medications. With this, our device would create a simpler solution for the treatment and prevention of rheumatoid arthritis. Here are references. Thank you. Any questions?